Hello friends, this is a case of a CSF rhinorrhea in an elderly female. So here you see there is sac collapsing from the defect, and this is a meningocele and it is collapsing because of a high CSF pressure. So once you see this white structure, so you should be very careful, and first step is to go around this sac and then go 360 around this sac so that you identify the defect from where it is prolapsing. And also as we are not sure of the content of the sac, so first step is to go around the sac fully 360 degrees. So once you are around the sac, then you gently cauterize the sac wall and then fully cauterize the sac wall all around, and then you try seeing the defect. So now after cauterizing the sac, we are seeing there is a huge defect in the skull base, and now you see a brain matter under surface of the brain, and then also with good blood supply on the undersurface. So once you see the other important step is to just cauterize the edges of the defect. So here we are cauterizing the edges of the defect, and now we are preparing for middle turbinate flaps. So this flap is very important in such defects. So now you just take the make the middle surface of the middle turbinate raw, and also take the thick bone of the middle turbinate away, so that it should be very pliable and it should be easily placed where we want it to place. Now I'm checking the integrity of the flaps. It's all fine. So now this is the middle surface is fully raw, and once you check the integrity, and then you see the length of the flap should be good enough to cover the skull base defect. Now the next step is to take a globular piece of a fat either from thigh or from abdomen. So once you take these globular fat pieces, they are easy to manipulate and they can easily be incorporated into the defects. So try avoiding any foreign body material like Surgicel or something, although they are safe and evidence is there to use them. But generally we should avoid this placement, and these fat plugs are very good and easy to handle if we take a globular piece of a fat. And after placing the fat plug nicely into the defect, now you take a perichondrium. Now you take a cartilage with a perichondrium and place it into the defect. We can also use a facial attar or temporalis fascia, because in this patient defect was bony and it was a big defect, so we opted for a cartilage. So once we place the cartilage and it was snugly fitting, and then we made a middle surface raw everywhere so that the flap which we are going to place should adhere well, and this is the whole concept we should follow. And now you see the integrity of middle turbinate is so good that it is because it has a good blood supply from the sphenopalatine branches. So now you fully covered the defect. So here we are fully covering the defect, and when you are covering the defect, one thing you should be careful that the frontal sinus drainage pathway should always be patent. So here middle turbinate flaps we have used, by superior and inferior flaps we are using to fully cover the defect. Although the movement of the mobility of the flap from the inferior side covered the defect closely, still to be very sure and some having double effect, we also have some superior flap from the middle turbinate which we placed of the defect, and then here frontal sinus pathway was well patent. Thank you so much.